Victoria's COVID crisis has taken another turn with a dramatic intervention into private aged care homes. The Army and public nurses are being sent into facilities as the number of cases linked to aged care nears 800. There were 384 new cases in Victoria overnight. 6 more people have died. 4 of them were in aged care homes. Hundreds of other workers are in quarantine awaiting test results, leaving the aged care system at breaking point. Almost all elective surgery in the state will now be suspended to free up hospital beds and staff to help with the crisis. Here is state political reporter Richard Willingham.
I want to see my mum.
As anxious families gathered outside a Melbourne nursing home for a second day in a row, some residents were being evacuated to hospital.
I don't trust them, so I've run back here because I want to see my mum. I want to make sure my mum's all right.
Overnight, the Army stepped in to help staff at Epping Gardens, where 82 people have contracted the virus. At nearby St Basil's, there are 80 cases. For Effie Furtadis, the anxiety about her father has been replaced by grief.
They took him to the hospital on Wednesday and he died Saturday.
Like many who've lost loved ones in aged care, she's also angry.
They treated my dad like crap.
Hearing people saying that their parents or the grandparents have been left in dirty nappies, not fed whatever, ants and all that.
Some of the stories we've seen are unacceptable, and I wouldn't want my mum in some of those places.
At the request of Canberra, the state has made a dramatic intervention. All non-urgent elective surgery in Metro Melbourne is being cancelled so that healthcare workers from public hospitals can be sent into private aged care homes. Reinforcements will fly in from interstate.
The urgency of the situation requires me to return to Canberra.
There are 56,000 aged care beds in Victoria. 10% of those are run by the state government and have mandated staff-patient ratios. But the current crisis is predominantly in private-run facilities, regulated by the Commonwealth. Of the 769 active cases in Victoria, just a handful are in public homes. Almost half of Victoria's COVID deaths have been in aged care.
There is a fear associated with caring for complex cases in a COVID-19 situation.
COVID-19 has killed tens of thousands in nursing homes around the globe, and it struck New South Wales in the virus's first wave. Yet some argue the private sector and the federal government were still unprepared for this wave.
We knew there was short staffing. We knew the staff were lacking the skills that they needed.
The idea that our carers, that our nurses are not providing that care, I think is a dangerous statement to make. They are wonderful human beings and I won't hear a word against them.
This is a nightmare scenario for residents, their families and staff, as well as the authorities scrambling to contain this virus. It will require governments to work together rather than pointing the finger. And the latest flashpoint of this pandemic will only shine a brighter light on a sector that's already the subject of a royal commission. Richard Willingham, ABC News, Melbourne.
As outbreaks at meatworks across the state ramp up, employees at a Melbourne abattoir stopped work for 4 hours today and refused to go back over safety concerns. JBS Abattoir in Melbourne West now has 75 cases. And as more schools close, the Principals Federation has demanded an end to face-to-face learning for VCE students. Here's state political reporter Bridget Rollison.
Year 12 student Mitchell Sprague is back learning from his lounge room after a positive case at his Keilor school.
It's been very disruptive having to switch from everything at school to everything at home and then everything back to school. And I've fallen behind a little bit.
More than 100 schools have closed since March, and this week Keilor Downs College was forced to shut for the 3rd time this year. The Principals Federation is now demanding all VCE students return to remote learning.
If I was a VCE student, I would be really concerned if I was in a school that is opening, closing due to infection. Very tough.
The public health advice has not changed. It is very low risk, but the reward is very, very significant in terms of getting our Year 11 and 12 students through.
But the risk has been growing along with the infection rate. Victoria has today recorded 384 new cases of coronavirus. The vast majority are linked to aged care homes and abattoirs. Workers at the JBS Meatworks in Brooklyn refused to work for 4 hours today, worried about their safety.
We had workers from the day and afternoon shift all crowded into a locker room together on their shift changeover. And we did finally get the company to agree this morning to put a half-hour gap between those shifts.
It's one of a number of outbreaks in the meat industry. The Somerville Meats cluster in Tottenham is almost 100 cases. There are 89 linked to Battoir in Thomastown, while the Australian Lamb Company in Colac has 50, and there are 10 at KR Castlemaine.
The common thread we're seeing with a lot of these outbreaks is insecure work.
Also feeling incredibly insecure are Dylan and Lisa Craw. Their 12-week-old baby Barnaby has just had surgery at the Royal Children's Hospital to repair a hole in his heart. In a ward 2 floors above, a newborn caught the virus.
COVID has made it twice as bad. Both of us can't be together in the hospital, let alone at the bedside. It's a very scary situation, but
they're doing everything they can to keep everyone safe.
All remaining babies in the affected ward have been tested for the virus, and so far they've all returned negative results. Some good news on another dark day. Bridget Rollison, ABC News, Melbourne.